Hi everybody, Roberta Heel here. Welcome back to NPGI. It's been a while. Okay, today I have a video for you that was let me see, was recorded. I'm trying to think of when, about a year ago actually. We've had some trouble getting our acts together, but I think it's been well worth it because it's Myriam Innocent. She's a nurse practitioner and she talks about her journey in being diagnosed with lupus and in opening a clinic to help patients to be the best that they can be with lupus. And it's a fascinating and interesting thing to watch. So I encourage you to listen straight through, and I hope you enjoy.
Hi, everybody. Today, I'd like to introduce someone very interesting and a great nurse practitioner ambassador, Myriam Innocent. Myriam, would you please tell us about yourself and your lupus clinic?
About myself. So I am, what to say about, I'm an avid reader. I have two kids, 6 and 3. I have been a nurse for 15 years. Of those 15, I've been a nurse practitioner for 10. I've had I feel like it would be a shorter list to say what I haven't done compared to what I have done in my career. I went up north. It was always a passion of mine, a wish of mine to work in, to do mission trips and stuff like that. But in my last year of school, at Queen's University doing my nurse practitioner, I actually fell very, very ill. And that's when I was diagnosed with lupus. And that journey was a very bumpy. At the time, they were ruling out non-Hodgkin's lymphoma. Like I had quite the presentation, weight loss, hair loss, fevers, sweats, extreme fatigue, and was initially tested for lupus, but was told that that wasn't what it was. So it needed to be confirmed by lymph node biopsy. Now, when I say lymphadenopathy, I'm talking about my lymph nodes were so big, I couldn't shoulder check without pain. And I looked like Quasimodo. So I was at the time working full time and doing the nurse practitioner program full time. And I look back now, I was going to school in Kingston, living in Ajax, and I was working in corrections doing HIV and Hep C case management. So a lot was going on, and I was newly married, like maybe a year. And, I think when you have that sort of near death experience, it really forced me to reprioritize things in my life. And, as a healthcare professional at the time, being a student in the healthcare system, it really opened up my eyes to a lot of the challenges that our patients face. And, despite being a healthcare professional, when we start to add different intersectional lenses, like being a woman, and then on top of that, a woman of color, it was interesting to see the patriarchy within our healthcare system. My husband is a police officer, and they kept on deferring to him, even though I was, the nurse, going to school to become a nurse practitioner. And it was really interesting to see that and to experience that firsthand. So as a result, I really became passionate about advocacy and sort of improving the patient experience. I really do believe that that experience is what's made me the type of NP that I am today. And I've been in remission with my illness for over 9 years. I've been off medication. And so the Manager Lupus Clinic was really founded because I feel that our traditional ways of doing medicine, there's an alternative, the true holistic way of looking at this disease, an autoimmune disease, I think is the only way to really get into remission. And remission looks very different from one person to the next. And so I just felt really passionate about being able to offer a service in a healthcare system that doesn't necessarily allow nurse practitioners to bill, and just found creative ways around that.
Oh my goodness. Thank you for sharing your story. That is quite alarming, what you went through. And I'm so glad to hear that you are in remission. But my goodness. So you started this clinic, and it sounds fascinating to me. It sounds like a great option for people. But can you tell me what perhaps some of the challenges in offering a clinic like this might be?
Well, it was really, I remember I was, when I had to do my lymph node biopsy, I was referred to Princess Margaret. And, the entire time I felt like the mistrust of the healthcare system kept on showing up, because I kept on saying, like, why are you sending me there? Like, this is a cancer hospital. Is there something you're not telling me? And it was like, no, no, no. But I asked for copies of every report, of every diagnostic report. And when I had seen the aspiration lymph node, it said non-Hodgkin's lymphoma versus necrotizing lymphadenitis. And so I was reading that in my car crying
Good heavens.
because neither of those things sound really great. And just sort of, I'm very, very faith-based. That's really like very spiritual. I think my spirituality has been really key and part of my own illness journey and recovery and remission. And so I just said, like, if I can get through this, I promise to be a champion for others so that they don't have to go through what I had to go through. And so when I was pregnant with my second child, I really used my maternity leave to really craft what I thought this would look like. And lo and behold, I was pregnant in 2018. I had her in 2019. My mat leave was due 2020. And right before, I had the website, everything created, then COVID hit. So that really put a pause on everything. And my son had some health issues around that time. So I really didn't know if this was really the way to go. I went back to my place of employment and sort of put it to the back burner at that point in time, because it was the pandemic and trying to navigate a new role, and now being a mother of two versus a mother of one, and then trying to teach your kindergartner at home with the online
Goodness.
was challenging. And it just, I think a lot of SNPs probably can relate to the fact that we don't leave our jobs, we leave people. And I just kept on feeling this feeling like, you know what, Myriam, after working so autonomously up north, it's really hard to come back down here where there's so many different people speaking into your work, and so many different barriers around you doing your work. And I just really felt like, once again, that I needed to do my own work and do something that didn't feel like work. And of course, having young children, wanted to be able to have a flexible work schedule, especially with my husband doing shift work, wanting to be more available to my kids. So I was just with a girlfriend one day, and she had opened up her own practice. She does aesthetics, and I think she was doing my eyelashes, something like that. And she's like, yeah, I had a couple of people renting rooms out of here, leasing rooms. It's just not a good fit. I'm just not going to post anymore. I just want to find the right person. And it was like a light bulb. Well, what about, I think you and I could be, yeah. And then that happened. I think that conversation happened last winter. And then I this place was opened up in May, and it's been interesting because I like kept my tax return money, like, and sort of put that aside for the business,
Right. Yep.
and but it became very apparent how things add up, right?
Oh, yeah.
So I was really fortunate in the fact that I had a partnership with had worked with a previous community health center, and I knew that lupus was a burden of disease that really does predominantly affect women, but also women of color. And so just went to them and proposed a workshop series for lupus patients and their loved ones to better support their loved ones with lupus, and for lupus clients, lupus warriors, to be experts at their disease. So I ran a series of workshops, and then also to build knowledge capacity within our medical community, a healthcare provider series, because it takes on average 7 years for a diagnosis of lupus. Well, 7 years, organ damage can look very different from one person to the next. So if our index of suspicion is increased, and healthcare providers feel better equipped and are really more paying closer attention to lupus as being a differential, we could really be affecting people's lives in a much affecting people's lives and giving them better outcomes. So I've just finished an English series, working on the provider series, and then I'll be offering that in French as well, because I'm bilingual.
Oh my goodness, that's wonderful. So are those series available to the general public?
Not right now. They will be. I'm going to probably do modules and such, so that anybody could access them, and it doesn't have to be just accessed through another stakeholder or another community health center. It's sort of just evolved. I knew that it's only through increased awareness and education that that we could really affect change. And I spent a number of years working remotely in Attawapiskat and Peawanuck, where I saw quite a bit of lupus as well. And my experience with working with trauma in particular, I started to notice more of a trend. And the research supports how unresolved trauma manifests itself in autoimmune disease. And that's sort of what pushed me to going back to school, and I'm pursuing my doctorate in psychology right now, mostly because every client is like, why can't I speak to you about my issues? And, and I'm, especially in the Francophone community, there aren't very many French speakers in the greater Toronto area that can provide psychotherapy. And so it sort of naturally evolved that way. I can't say that when I graduated, I knew that this would have been the end result, but I'm very, very happy. And I think there's no price that you can really put on that, right? So.
No, that's amazing. Okay, I'm going to put you on the spot here.
Okay.
And I can take this off if you need to, but
yeah.
And all the reading I've done about COVID shows that women in particular, middle-aged women, but generally speaking, people can have an autoimmune response, and it can trigger autoimmune disease. In your research and experience, have you noticed an increase in people with lupus-like symptoms and that sort of thing after a COVID episode?
Just based on my research, a lot of the constitutional symptoms are very similar to lupus.
Okay.
And I remember, even for me, making the decision to get vaccinated, you had the pharmaceutical companies coming in and providing these presentations where they're saying, oh, may cause a flare-up of autoimmune disease, or may trigger a new autoimmune disease. and really having to make that decision of trying to pick which is which is better. But knowing that I had children in childcare and schools, and my husband works in, in policing, I was able to make, just make a decision based on our risk factors that, I wanted to get vaccinated. But in terms of COVID, and I think more and more research is going to come out that's going to show that, not only COVID, but isolation, alienation, mental health, and then of course, our social determinants of health, how I think it's going to have a huge effect, negative effect on people's lives. And we're just going to be able to see that evolve. You just made me think of something else, is we lost our mother-in-law unexpectedly early in the pandemic. And she was supposed to be cardioverted for atrial fib. As you know, everything got delayed. So this was in September of 2020. And I remember her calling me on the Monday, telling me she wasn't feeling well, and was really encouraging her to go to the hospital, nausea, vomiting, diarrhea, just really not feeling well. And she doesn't complain, right? So if she's complaining, it's bad. I was really trying to encourage her to go to the hospital. And then with all of the media around, don't go unless you really need to go, unfortunately, my husband was working a night shift, and I had encouraged him. He went to go. My plan was to send him over to his mom's and encourage her to go to the hospital. And when he got there, unfortunately, she was VSA and was unable to
oh my goodness,
be resuscitated.
just
so
terrible.
It was, yeah. And I think there's been a lot of lessons that we've learned as a result. Like, healthcare can't stop in the middle of the pandemic, but at the same time, I think when our infrastructure is already so overburdened, it was just the perfect storm, really. So yeah, she was only 69 years old.
Oh my goodness.
So just had recently retired. So it was really, and unfortunately, I love to see that's the only story. I'm sure many people have many stories over the pandemic, where they've lost a loved one. And then, the grieving process to that, how that was affected with having a funeral. And I just think there's so many different things I think if never before, I really think primary care is really more needed, even more so coming out of this pandemic than even before, as we deal with the consequences.
Yes. And certainly, my goodness, so certainly during these very, very stressful times, you were developing your own clinic to support people with lupus. So can you tell the listeners a little bit about it? I mean, how do people access it? What is your sort of delivery model? That sort of thing.
So how do people access it? So it was challenging initially. I think once I had the space, a separate space, it made it easier, more credible, right? So, sometimes when you open up a business, and I think the pandemic has certainly opened people's eyes to virtual being an option and not being seen as inferior, an inferior option to in person. So really what I did is I partnered up with community health centers and just, let them know this is what I'm offering. And really through workshops that you get to meet people and their loved ones, people who have lupus. And I think, for me, I just want people to become experts at their own disease. So it's either they can come in person, I'm in Coburg, or I offer a virtual platform as well. It's a comprehensive, holistic assessment. So I don't I'm not replacing a rheumatologist. You're to follow your plan, but everything that I do, any recommendations that I do, is always in communication with their specialist and family care provider. And so sometimes it might just be, maybe you need to optimize a little bit more on your nutrition. And when we think of the foods we eat and inflammation that can arise from foods that we may not necessarily know that we're sensitive to. And then, maybe it's psychotherapy, that maybe there's a lot of unresolved issues, stressors going on right now. And maybe that is, so that holistic view, or sort of 360, so to speak, is really to sort of provide clients with a place to start from. Like, this is what you're doing really well, and these are some of the areas I think we could really optimize, and with the goal of remission, and what that looks like. From really, remission to me is being stable with your disease, right?
Okay.
You could be stable with your disease while on medication for a number of years. And even specialists don't really agree necessarily what remission looks like for individuals with lupus. So there's different levels of lupus. And I think what was really empowering for me to see was how clients felt empowered to make, certain decisions, and didn't feel as powerless. Well, all I need to do is present for my doctor's appointments and take my medications. That there's other things that they can be doing as well to improve their health.
Well, it certainly seems like your expertise as a person with lupus, as well as your expertise in the healthcare field, really make you the perfect person to be helping clients through this. And it sounds like a wonderful opportunity for people. So congratulations, because wow, you know what? I would say things are meant to be. If they sort of fall into place, then
Yes.
in my mind they're meant to be. So I sounds like there were so many potential obstacles, and yet here you are with this clinic up and running. So that's wonderful, and really been wonderful talking with you. And I just don't want to like take off and everything before I give you a chance to say to talk about anything else that that we may have missed, or that you wanted to let the listeners know about.
I think for nurse practitioners, the idea of independent practice is very daunting. I think really, when I did my schooling over 10 years ago, it wasn't the only thing that we really heard about was aesthetics. And I think some of the, I don't want to say pushback, that I hear is really around, a two-tiered level system, healthcare system. I don't believe that what I'm providing can be given anywhere else. And if I had the funding, sure, right? And I just think that we need to create opportunities for ourselves that not only benefit ourselves, but benefit the population at large. And I realize this is a very niche area, but it's one of a kind, and I think we all can offer different things. And I hope it was really great to be at the NPAO conference and to meet other nurse practitioners who are also in independent practice in different sectors, and to feel like you're not the only one alone. And not to say that being a primary care provider or nurse practitioner is not rewarding. It certainly is. I just feel with all the bureaucracy and all of the different mid-level management, it can be challenging. It can be challenging to stay happy in the work that you do, when a lot of the work that you're doing is not the work that you want to be doing, right? So
no,
I think
you're absolutely right. I think
yeah.
you've said that quite well. Somebody said to me, when you graduate as a registered nurse, You get a job and everybody understands what you're going to be doing. And yet, when we graduate as NPs, we get jobs and everybody's telling us how we're going to practice. And it's very, very alarming because that's not what we expected. That's not what we were told would happen. So we find people searching for their niche, as you've mentioned. And I think you're a lovely example of somebody who's found their niche and is working quite well towards it, towards offering that holistic care that is very different from what they are going to get either with the specialist or in their primary healthcare setting for the most part. So you're absolutely right. And thank you so much. This has been great.
Thank you for having me.